I thank the chair for the recognition. So here we are, just 2 weeks shy of the anniversary date of that big signing ceremony down at the East Room of the White House. We all remember how the vice president characterized that morning. So, but this bill does represent, this law now represents a fundamental change of the relationship of the government with the people. We've gone from government with the consent of the governed to now the government telling the governed what they shall get and when they should get it. Remember President Obama, when he was running in 2008, he made two promises. One was, if you like what you have, you can keep it. And the other was, we have to control costs, that way more people can buy insurance. Actually not bad ideas. What happened to, if you like what you have, you can keep it? Well, apparently that's gone by the wayside. And what the American people told us in the difficult summer of 2009 was, we're scared to death you're going to screw up what we have. Please don't do that. And the other part of that equation was, could you do something to help us with costs? Because we are dreadfully concerned about the cost of health care. Turns out, with the signing of this law, we screwed up what was working and we exploded the costs. Now, I do understand the difference between an authorizer and an appropriator. I've been an authorizer during my short congressional tenure. Mr. Ishtuk, when he was here, was an appropriator. My first field trip out to the NIH, I was taken to all of these big, beautiful buildings, all named after appropriators. I said, where's the building named after the authorizer? There aren't any. But I do understand the very fundamental nature of what we do as an authorizing committee. It is our heritage. And our strength comes from carefully investigating and carefully vetting those expenditures that we then pass off to the appropriators to eventually write the check. And the oversight function that occurs at the authorization level is something which cannot be minimized. We've gone through almost a year of this. In fact, we went through the first 10 months before we had a single oversight hearing from any of the relevant federal agencies over what just was going on with the implementation of this. Now, look, we are all hearing today about the problems with the federal budget. February, $223 billion overdraft. February, I might remind people, is the shortest month of the year. That means that's as good as it's going to get this year, $223 billion overdraft. And what do we get for it? Do you see new clinics? Do you see new schools? No, what you see is an overdraft. And it gets worse because as this thing is implemented, we go on to subsidies to middle-class families in the exchange to help them buy health insurance. And the answer there is a tap with a high-pressure line into the federal treasury. That $223 billion deficit is something for which we will all wax nostalgic after that kicks in this bill. The mandatory spending, which we are all talking about, needs to be brought back under the control of this committee and be authorized. You don't have to be against something just because you want to label it mandatory. It simply means you want to have the correct amount of congressional oversight.